Hi, good morning, everyone. I am Rahul from Saveetha College of Physiotherapy, a final year student. Now, my project is effectiveness of blood flow restriction therapy in patients with type 2 diabetes mellitus. Nowadays, diabetes is the most common condition among the world. So, my project is reduce the diabetes in a diabetic patient with the help of BFRT. BFRT means blood flow restriction therapy. This project was done under the guidance of Dr. Pratap Sugandhira Prabhu, principal of Saveetha College of Physiotherapy. Introduction. Diabetes mellitus is a group of chronic metabolic disorders characterized by elevated blood glucose level, hyperglycemia. It results from either deficient insulin production by the pancreas, insulin resistance, where body cells don't respond properly to insulin, as in type 2 diabetes mellitus. Insulin is a hormone secreted by the beta cells of the pancreas and is essential for transporting glucose from the blood into cells. Glucose is a primary source of energy for body cells. Without insulin, or in cases of insulin resistance, glucose remains in the bloodstream, causing persistent high blood sugar. Prolonged hyperglycemia can lead to chronic complication affecting eyes, kidneys, nerves, heart, and blood vessels. Insulin is not only essential for glucose metabolism, but also plays a role in fat storage, protein synthesis, muscle repair, and growth. Traditional high intensity training may not be suitable for all diabetic patients. BFRT is a novel method that mimics high intensity benefits using low intensity loads. It activates fast twitch muscle fibers that consumes more glucose anaerobically. Now review of literature. Nehom et al. Insulin resistance and muscle fiber types. The study focused on individuals with a genetic link to diabetes. These individuals had a higher number of type 2B muscle fibers, which are fast twitch glycolytic fibers. Type 2B fibers are less sensitive to insulin and have low oxidative capacity, contributing to reduced glucose uptake. Despite similar physical activity levels, insulin resistance was still higher, indicating a muscle fiber based mechanism. Now, BFRT is ideal for this because it directly stimulates type 2B fibers using low loads. Next, Hansen et al. Low versus high intensity exercises in type 2 diabetes. St Study included obsessed type 2 diabetic patients, compared low moderate intensity training versus high intensity training. Both groups showed significant HbA1c reduction, indicating improved long-term glucose control. Other benefits observed in this research: improved LDL, cholesterol, bad cholesterol, reduced in body weight, improved insulin sensitivity. This supports the use of BFRT, as it is a low intensity method that can yield high metabolic output. Next, Wilfred Y. Fujimoto, the central role of insulin resistance study, highlights low insulin resistance is often the first sign before diabetes fully develops. In populations moving from rural to urban lifestyles, insulin resistance increase due to weight gain and inactivity. Even if insulin secretion is reduced, normal can be maintained if sensitivity is high. But when sensitivity drops, glucose regulation fails and type 2 diabetes sets in. Emphasize need for interventions that targets insulin sensitivity, which exercise and BFRT both enhance. This studies tells about this. Okay, now the background of the study. In diabetes, insulin plays the major role. Insulin is needed to move glucose from the bloodstream into cells to produce energy. When this mechanism fails, sugar remains in the blood, leads to complications. Glucose and muscle relationship. Skeletal muscles is a major site of glucose uptake in response to insulin and exercise. A regular muscle contraction enhance glucose transport via GLUT4 receptors even without insulin. Therefore, muscles plays a key role in blood sugar rejection regulation. Role of exercise in diabetes management. Physical activity increase insulin sensitivity, reduce body fat, and improves glucose control. Traditional exercise helps, but may not be suitable for all patients. Diabetic patients with obesity, arthritis may not tolerate intense workouts. This creates the need for the safer but equally effective alternative like BFRT. Now, introduction to BFRT. BFRT involves applying a cuff or band to partially restrict blood flow during low load exercises. It limits venous return while maintaining arterial inflow, creating a hypoxic state in muscles that triggers the activation of type 2B muscle fibers, which are rarely used in low intensity training. Why type 2B of muscle fibers matters? People with insulin resistance often have reduced glucose uptake in their type 2B fibers. Activating these fibers through BFRT can improve their responsiveness and glucose utilization. Physiological effects like in BFRT, it promotes muscle hypertrophy, hormonal release like growth hormone and IGF-1, improved vascular function, enhanced glucose transport and muscles. These effects happen with light loads, making it safe for diabetic patients. Now, need of the study. Many type 2 diabetic patients are unable to perform high intensity exercise due to obesity, joint pain, or cardiac issues, arthritis like this. Uh, Blood flow restriction therapy offers a safe, low intensity alternative that activates glucose burning muscle fibers. It allows better glucose control with lighter exercise, reducing the physical strain or in patients. There is limited research on using BFRT in diabetes management, especially in physiotherapy setting. This study is need to explore BFRT as a practical, effective tool to help physiotherapists manage blood glucose in diabetic patients. It helps the patient to perform and it gives more confidence to the patient to do the activities and to feel the effects how they do high intensity exercise by doing BFRT with low intensity exercises. Aim and objectives. Aim to assess the effectiveness of blood flow restriction therapy in patients with type 2 diabetes mellitus. Objectives to determine the effectiveness of BFRT, blood flow restriction therapy, and to analyze the changes in blood glucose level after BFRT, but after the blood flow restriction therapy. Now methodology. In methodology, sample design. This is an experimental study and subject settings. Subjects were selected from Saveetha hospital based on inclusion and exclusion criteria. And sampling technique. This is a convenient sampling. Sample size 60. Now inclusion and exclusion criteria. Inclusion criteria: patients with type 2 diabetes, age group between 30 to 50, and range between 280 to 450, both male and female. This is the inclusion criteria. And now exclusion criteria are patients with deep vein thrombosis, cardiac failure, and peripheral vascular disease. Patient with type 1 diabetes and gestational diabetes also as a exclusion criteria, and patients with high blood glucose levels. These are the exclusion criteria. Next, study procedure. We split the 60 sample size into 30. Group A 30 patient and Group B 30 patient. In Group A undergo with the BFRT with medications, and Group B was undergo with the aerobic exercise with medications. Now the outcome measures is glucometer to check the blood glucose level in the body. Then the study were conducted for the 4 weeks with four sessions. Uh, Now group A, these patients are undergo with BFRT with daily medications. Group A blood flow restriction therapy they undergoes. BFRT is used to mimic the effects of high intensity strength training using low intensity exercise. It helps in stimulating muscle growth and improving glucose metabolism by creating a temporary hypoxic environment in the muscles. This leads to increased glucose uptake, growth hormone release, and type 2B muscle fibers activation, important for the diabetic patients. Now, protocol details duration 30 minutes per session, frequency 4 sessions per week, total duration 4 weeks. Now, exercises included in this patient by using BFRT. The exercises are Arnold press, bicep curls, tricep curls, lateral raises, uh, SLR, squats, calf raise, and pelvic bridging. These exercises were selected because they involve major muscle groups important for glucose metabolism, are safe to perform under BFRT even with light weights, and support muscle endurance, joint stability, and functional strength. Now group B aerobic exercise. Duration 30 minutes per day, 4 days per week, and 4 weeks. Mode of exercise, walking and cycling. A purpose of aerobic exercise in this study to improve cardiovascular endurance, to enhance glucose uptake by muscle, beneficial in type 2 diabetes, to stimulate insulin sensitivity and lower blood glucose level, to compare the effectiveness with blood flow restriction therapy, BFRT. Pre-exercise screening, blood sugar and heart rate checkup, and comfortable shoes, clothing for walking. Stationary cycle is preferred for older or balance compromised participants. Uh, it decrease in HbA1c level, weight reduction or fat loss, improved lipid profile, reduction in blood pressure. Now it helps. This group is helps to compare the BFRT is more effective than the aerobic exercises. Results. BFRT, blood flow restriction therapy, was more effective in reducing blood glucose than traditional aerobic training. This supports the idea that activating type 2B muscle fibers leads to greater glucose consumption. The significant drops suggest that blood flow restriction therapy involves insulin sensitivity and promotes glucose uptake. Despite both groups showing improvements, BFRT had a superior outcome. This indicates a blood flow restriction therapy may be a better option for certain diabetic patients, especially those who can't perform intense cardio. BFRT can be used in clinical physiotherapy settings as a low load joint friendly option for diabetic patients. And it reduces the need for medication dependency when combined with lifestyle changes and encourages individualized progressive exercise plan for diabetic management. BFRT that makes better muscle fiber recruitment and greater metabolic stress and lactate accumulation leading to hormonal response. And this result shows that BFRT is more effective than the normal aerobic training like walking and cycling. And the glucose, glucometer, the outcome measure checked by this is glucometer. Discussion. BFRT, blood flow restriction therapy, creates a low oxygen environment in muscles, which stimulates type 2B muscle fibers. These fibers rely on glucose for energy, so their activation improves glucose uptake and insulin sensitivity. The BFRT blood flow restriction therapy group showed a greater reduction in blood sugar compared to the aerobic group exercises like walking and cycling. Blood flow restriction therapy also promotes muscle strength and helps prevent muscle loss in diabetic individuals. Although both groups improved, BFRT proved to be a more efficient and joint-friendly method. However, BFRT must be done under supervision to avoid risks like circulatory issues or discomfort. Further research is needed on long-term effects, ideal pressure levels, and patient-specific protocols. Conclusion. Both BFRT, blood flow restriction therapy, and aerobic exercise were effective in reducing blood glucose level in type 2 muscle diabetic patients. However, BFRT showed a significantly greater improvement, suggesting it may be more beneficial. BFRT, blood flow restriction therapy, is a safe, low intensity, and effective exercise method for patients who can't tolerate high intensity workouts. So it gives effects how the patient do a high intensity exercise by doing low intensity exercises. It can be used as an adjacent physiotherapy tool in a diabetes management. References. These studies support the rationale and outcome of my project. My reference include global diabetes data, studies on diabetic complication, risk factors, and BFRT research together. They support the rationale for using BFRT as a safe, effective physiotherapy tool in diabetic management. So, thank you for listening to my project.